Okay, I think the time has come. So we're going to jump in. Welcome, everyone, and thank you for joining I think this is our first live stream. We're titled Maximize Your Pay in Home Care, a practical guide to navigating the Indiana Medicaid waivers. If you have any questions, please feel free to drop them in the chat, and my either one of my colleagues will answer if it's a simple question. We may have time at the end for questions and answers, but likely not today. However, any questions or comments that are left, we will absolutely respond to either later today or tomorrow. In addition, all of you should have gotten a welcome email for signing up and registering for the webinar. So, and that had my contact information. So please feel free to reach out with any questions or comments after the fact. I'm always happy to help or to hear feedback. My name is Jack Rabinowitz, and I'm a licensed clinical social worker with Passion to Care, a home care agency that operates in Indiana. And my job focuses on strategy for improving patient outcomes and our caregiver experience. And with that, let's jump into the webinar. So we're going to have 3 different parts, as I know, to this webinar. Now, I know we might have a variety of different people tuning in before, during, or after. We have some people who are prospective, caregivers with the waiver program. We have people who are active family caregivers, active non-family caregivers, as well as some case managers and other people who are tuning in. And we're going to try to touch on helpful information for each person to understand the programs a little bit more in depth, how they work, how to navigate them from the inside, and of course, what are some practical strategies for how you can improve and maximize your pay. In the program part 1, we're going to focus on the Medicaid waivers. What are they? What are the basic rules, qualifications, and how do they work? Part 2 will be navigating the waiver programs and some of the details, how to choose the right one for you. And part 3 is negotiating the best rates that you can for yourself. So part 1, Medicaid waivers. I think the first thing we have to understand, basic question, is what is a Medicaid waiver? What does that mean? So Medicaid, as I'm sure most people are familiar with, is an insurance program, part of our social safety net, that is a partnership between the federal government and each of the individual states. So there's federal funding, federal rules and guidelines, and then it gets customized with each state in order to care for people who can't afford and don't have access to other forms of healthcare. Now, regular Medicaid is like regular health insurance that'll pay for you to go to the doctor, for a procedure, for medications, etc. Now, one part of the healthcare system is when people are no longer able to take care of themselves on their own. We have nursing homes where they can provide both medical and support with activities of daily living to help care for people in with the age or with disabilities. And when a person was no longer able to care for themselves, and if they didn't have family who was willing to care for them, the traditional process was that people would be sent to nursing homes, or sometimes they referred to back then as old age homes. And the problem with this was twofold. One is that people didn't like them. They don't like having to leave their home. They don't like to leave their family. Don't like being in this institutional environment where sometimes there's great care and sometimes the care can be subpar at some places. And the flip side was that for this disappointing solution to this really serious problem, the government was paying a tremendous amount. The average cost of care is somewhere in the range of $9,000 a month to be for care in a full-time care in a nursing home. It's a little bit less in Indiana. It's only about $7,000 or $8,000 a month on average for full-time care in a nursing home. And so they created these waiver programs to waive your right to full-time institutional care in a nursing home, to be able to age in place and remain at home for as long as possible. And the government put in a variety of different solutions, waivers, and services to allow people to receive as much care as possible at home, which is oftentimes patients' preference. And the goal oftentimes is that the government ends up saving a tremendous amount of money by providing these services and allow people to age at home. Now, there was a second wave in which they created specific programs and carve-outs to allow people not just to age in place at home and to receive care to do so, but to allow family members to be able to do this and help support them, as this is oftentimes a strong preference from family members. And you should note and be proud is that the state of Indiana has some of the most generous rules to support family caregiving compared to most other states. Now, jumping right in, what are the qualifications? There are two categories. There is both medical and financial. The medical is specific to each waiver, depending on what it is in the rules, and we'll get into some more details later. And the financial, again, can vary in different situations, but essentially for an individual, your income is limited to $2,901 per month and $2,000 in eligible assets. So that means cash or cash equivalents in a savings account, in a retirement account, in an annuity, or a whole life insurance policy. However, there are some non-countable things like a car and a home. The details are going to be beyond the scope of this webinar, but if you're looking for information, please feel free to reach out for more detailed advice or guidance. There also changes if a person is married and has dependents and other things like this, but this is the general overview. Now, what are the most common waivers in Indiana? You have the health and wellness waiver, the pathways to aging waiver, the traumatic brain injury waiver, or the TBI, sometimes it's referred to, the family supports waiver, and the community integration and habilitation waiver. There's also waivers from the Division of Mental Health and Addiction. However, they provide a different category of services very often and are outside of the scope of this presentation. So to start, the health and wellness waiver and the pathways to aging waiver are very similar, and they cover most general forms of disability. And they're divided primarily by person's age. So the health and wellness is for those who have some sort of disability that requires a nursing home level of care, but they're under the age of 60, so up to 59. And the pathways to aging waiver provides the same sets of services and supports and care for those who have a disability that requires a nursing home level of care that are 60 years or older. The TBI, as you can imagine, waiver is for those who have a traumatic brain injury, are ages 18 to 64, and demonstrate functional deficits in 2 activities of daily living that require a nursing home level of care. Now, we have 2 waivers in Indiana for people with intellectual or developmental disabilities. These are the family supports waiver and the community integration and habilitation waiver. These are for things like autism, cerebral palsy, and epilepsy, and other related diagnoses. Onset must have been before the age of 22, with the expectation that it will not improve. There's slightly different diagnostic criteria for qualifications that are listed below, with 3 deficits and limitations in 3 major life areas: self-care, use of language, learning, mobility, self-direction, and capacity for independent living. The main distinction between these 2 waiver programs is the level of care that's necessary for this person to function. So for the family supports is geared towards providing services for a person who's able to live in the community in a non-institutional setting. And the community integration and habilitation waiver is geared for people who need a higher level of support and care and to provide those in a residential facility. Quick note on VA and the MFP programs. So the Department of Veterans Affairs also provides home care for qualified veterans. Those are for people who have served active duty. They cannot have been dishonorably discharged. There is a income limit of $28,300 per year for a single veteran, or $33,548 for one who is married. So the income limit is slightly lower than with Medicaid. However, the asset limit is significantly higher at $159,240. Money Follows the Person is a federally funded program to help those who are currently receiving institutional care in some sort of nursing home or hospital to be able to move back into the community. It provides funding and extra supports for this transition into home care for a year before a person needs to transition back into one of the other waiver programs if they still qualify. That brings us into part 2. How do we navigate these programs? Now, it's important to note, in Indiana, there are 2 primary home care services that can significantly impact caregiver pay. These are the structured family care and attendant care. Now, let's understand a little bit more about what these are, what they have in common, and what makes them distinct. Now, there is much eligibility overlap. Structured family care, as the name implies, is a specific service line that is cut out for family members to care for their loved ones at home. The basic requirement in Indiana is that people need to live at the same address. They need to live in the same home. And if you live in the same home, then you're likely be a qualified caregiver who's eligible to provide structured family care. Now, structured family care is very different than the attendant care program, which is the traditional service line in which the Medicaid would pay to send a caregiver who's likely not related to you to the home in order to care for somebody, and in which many family members rather, are eligible to be hired as that caregiver to be sent to the home. So you could be a family member, for example, a child who is caring for a relative on both structured family care and attendant care. And very often what will decide whether you get moved into one service line versus another is whether you live at the same address. So if you live independently from your relative who you're caring for, then you're only eligible for attendant care. And if you live at the same address, then you're likely eligible for structured family care. Now, with structured family care, there's additional advantages, which is there are certain relatives who you're able to care for with SFC, structured family care, who you're not able to take care of or with the attendant care program. Meaning, if a patient, if you have a patient on one of these waivers, their spouse cannot be their caregiver on attendant care, only on structured family care. And the same is true if a person is caring for their child who's under the age of 18 or someone that they are legally responsible to care for. They are eligible to care for them, but only through SFC, where they're living at the same address. Now, basic qualifications for a caregiver, we won't go through the whole list, but every caregiver must go through a background check. That is a 10-year look back. However, only certain crimes are disqualifying, such as elder abuse, certain theft charges, and violent crimes. Crimes that are more than 10 years in the past are not disqualifying, and other non-disqualifying crimes and misdemeanors are not problematic. Only specific list in the different categories that I mentioned, although that is not completely exhaustive. There are other examples as well. And as well, there is a specific exemption for patients on the attendant care program only that allows for a patient to sign an attestation if they are related to each other, that they understand that their relative has some sort of disqualifying criminal history, and they accept them and want them as a caregiver nonetheless. Now, one other important distinction between the two programs is that attendant care, you are paid and it is billed on an hourly basis. The amount of hours that you can care for the relative or the patient are decided by the assessment that's done through the case management and the case management companies, and the oftentimes it's done through a nurse. And they decide what level of care a person is entitled to, how many hours a week of care they need. Or conversely, if a person is going to be on the structured family program, which level of structured family care that they are entitled to. There are 3 levels in Indiana, level 1, 2, and 3, that are roughly meant to parallel different categories of hour approvals. So level 1 roughly translates into part-time care of less than 20 hours. Level 2 roughly is to a moderate level of care between 20 and 39 hours. And level 3, which roughly translates to full-time plus, meaning 40 plus hours of care per week. The structured family care, importantly, is paid at a daily rate, usually for 7 days a week. And what's really important to note, though, is that this is not regular salary. If you're in the attendant care program, you're hired as a regular W-2 employee. If you're on the structured family care program, you're hired as an independent contractor. And this is part of the rules of how it's set up. But the money that you earn or are paid is a tax-exempt stipend. Now, when you file your taxes, what does it mean? How does this work? You should probably refer to some sort of tax professional. What it means is you should probably report it as income, but as exempt income, and no money is withheld from that payment, and no taxes should be paid from that income in structured family care. Now, because of that, that makes some pretty significant differences for how that will end up defining how much a person can earn, depending on whether they're in structured family care, where they're not paying taxes and they're paid on a daily rate, versus in one of 3 levels, versus someone who's working through attendant care, paying taxes on an hourly basis. Now we have this chart here, which kind of shows you how it intersects, how now all of this is very individual depending on the rate that you're offered on either on an hourly basis with attendant care or on a daily basis with structured family care, as well as the number of hours that are approved and the level of SFC that are approved. Now, if we look, you'll see that typically, if you qualify for structured family care and the patient needs a low level of care of less than 20 hours per week, financially, you'll end up making a bit more in the structured family SFC1 program, where you see that the lines cross here at about 22 hours. And that's the point where attendant care average rates for attendant care break even with the average SFC1 rate. For now, SFC2, which again is roughly 20 to 40 hours of care, we'll see breaks even right here at around 28 and a half hours. That's the point where you would make the same amount of money on either program, if you're making about 28 and a half hours of attendant care versus SFC2. So if you're making less than 28 and a half hours, then you end up finding in a financially advantageous situation to be an SFC2. But if you're 29 hours or more on attendant care, you'll end up making more money than you would on SFC2. And the line where they cross for SFC3 is 39 hours. So anyone who's working 40 hours or above will usually make more money on the SFC program than they will on the attendant care program. Now, some important things to keep in mind that are going to affect the pay rate, and we're going to go into this more, is that if a person is approved for more than 40 hours of care, then they are entitled by law to overtime. This is not applicable to the SFC program, in which the patient and the caregiver are living together and are not billed an hourly rate. It's rather a flat daily rate. Now, a quick note on PA hours and homemaker hours. So for those who are currently working, you may have heard these terms or have seen these things or have this discussed and may not have a full understanding of how and why. And so we'll hopefully shed a little bit of light on this. So homemaker hours are a different service line in parallel to attending care hours, which are meant to be less hands-on personal care. It's things like cooking, cleaning, running errands and things like this, as the name suggests, homemaker, as opposed to things that more hands-on care like helping people with bathing, dressing, feeding, transferring, and etc. In the reality, Medicaid pays a little bit less. Their reimbursement is lower for this service, but usually it's a small amount compared to the overall attending care hours, and it does not usually impact the caregiver's actual pay or the work that they do. PA hours stands for prior authorization hours. Now, this is a service line that's actually outside of the waiver programs, and it is a prior authorization to provide more intensive care at home. Usually, it involves some sort of home health, actually health service with a nurse or some sort of therapist that they come to the home to provide this care. However, it sometimes can include personal care and attendant care, and oftentimes will be batched along with a waiver approval. So a person might have 10 or 15 PA hours, and they might have 20 or 30 attendant care hours. Practically, what that means is two things. One is that if the patient is qualified for both or approved for both, that the caregiver might need some extra training and different supervision and oversight when providing PA hours in addition to attendant care hours. In addition, a person will have to clock in and out in between PA hour shifts and attendant care hour shifts. It's also important to know that not all agencies can service PA hours. This is a different license, and that has more oversight and quality assurance and regulations for the agencies to follow. So not all of them carry this license. Now, understanding a little bit of the relationship between case managers and the case management companies, or case managers provided from the managed care organizations and entities, insurance companies, and the home care agencies. So when Medicaid and the state of Indiana set up these waiver programs, they divided the administration between the case management and the home care agencies, and this is to try to prevent waste, fraud, and abuse. And now, what that means is that the case managers are there to, one, assess and find out what are the needs of this patient. In addition, to be able to help provide these resources, it's to provide oversight and assessment to make sure that a person is qualified for this level of care and decide what level of care a person or a patient is eligible for. So that's where these determinations are oftentimes made between whether a patient gets 10 or 15, 20, 40 plus hours, or the SFC level 1, 2, or 3. In addition, the case managers oversee the eligibility, and they control the flow of money, right? They are the ones who take the, kind of deal directly with Office of Medicaid and the government and send the approvals from one provider to another based on the patient choice. And in return, the home care agencies provide the day-to-day functioning. They do payroll, compliance, background checks, making sure the caregivers are qualified, are following the rules, are clocking in and out as they're supposed to, and providing all different sorts of other required oversight and compliance. So practically what that means is that the case managers manage the flow of money and approve whether or not a patient is qualified and how much care they're qualified for, whereas in addition to their other responsibilities of making sure that patients have access to the care and the services that they need. And the home care agencies provide the service on a day-to-day basis. And they provide the care on a day-to-day basis. And that brings us into part 3, where we're going to dive a little bit deeper into practical strategies for negotiating your rates and understanding how these pay rates are set. Now, how are they determined? Medicaid in the state of Indiana, they set a reimbursement rate for different services that they're willing to pay for a given service, whether that's an hour, a day of SFC 1, 2, or 3, or that's an hour of attendant care. And then that money is divided between the caregiver and the agency. The agencies decide how much they can afford to pay out while still providing the oversight and overhead required for the day-to-day functioning. And then the caregiver, and the rest is paid out to the caregiver. And their specific rate is impacted by their qualifications, their experience, as well as overtime hours. If you're in the attendant care program and your patient, either you're working with multiple patients or your patient is approved for more than 40 hours a week, the government doesn't pay for overtime. The home care agencies do, and if you are working more than 40 hours, every hour on top of that is paid time and a half. Now, how to maximize your rate? The first is don't be afraid to price shop. There are a lot of companies out there that offer different rates and are more, and so don't be afraid to look and find out, are you getting paid as much as you can, or are there other companies out there willing to offer a better rate for your services? The second is don't be afraid to ask for a raise. That rates are given, rates are negotiated, and oftentimes people leave it at that. And the bottom line is that companies make more profit if they pay lower rates. And so they are not incentivized or motivated to check in with you and provide regular raises or rate increases unless you speak up and let it be known and you ask for what you want and what you need. I can't guarantee that it will be given, but I can guarantee that you're not going to get as many raises if you don't ask for them in this line of business. So don't be afraid to ask for a raise if you've been at a company for a year or longer. And number 3, making sure that you're at the right type of company, that there's a wide variety of different companies in this space. And you have to make sure that which company you end up partnering with or working for makes a big difference. So the first thing is that there are some companies which are smaller and there's some that are bigger, and there's advantages and disadvantages to each type. If you're at a smaller company, oftentimes they have less overhead. Oftentimes they're looking to grow, and therefore they're more have stronger motivations to offer higher pay rates for caregivers. Now, that comes with the kind of the risk of working with those companies, which is oftentimes they're less organized, they're less structured, they may not have as good technology, and they also sometimes aren't as financially stable and reliable. And we have many caregivers and clients who have come to us from other agencies that have closed down because they weren't able to make it financially. Then you have very large companies in the space who are very reliable. Often there's a very organized customer service, kind of support systems in place. However, very often with that size comes a certain amount of institutional, kind of corporate philosophy with CFOs and kind of margin rates and all different sorts of things that can oftentimes lead to people more strict limits on the pay rates that they can and will offer. I will, throw out a pitch. Passion to Care happens to be, from my personal experience, a beautiful synthesis right in the middle as a medium-sized company, which is, financially strong and stable with a very strong focus on customer service, but also offers some of the best rates in the industry. Now let's jump into the details. What should your rates be? How do you know if you're being underpaid or not? If you are on the attendant care program and you are being paid less than $19 an hour, I can tell you, you can do better. Whether it's asking for a raise or shopping around to other companies, that you can earn more, at least $19 an hour on the attendant care program, and it's worth reaching out for an assessment or evaluation or a quote if that is the case for you. If you're on SFC 1, you should not be making less than $50 a day. Otherwise, you absolutely can do better, whether that's asking for a raise, like we mentioned before, or shopping around to a different provider. SFC 2, the floor should be $65 a day. And if you're making less than $85 a day on SFC 3, again, it's time to renegotiate your rates or shop around for a different provider. That brings us to the end of our webinar. Again, if you're interested in hearing more, finding out if you are eligible for this service or to potentially looking into transfer to Passion to Care, you can feel free to scan this QR code, or you can email us, you can go to our website, you can drop into our office in person, you can call us, you can text us with the information provided or the direct line that I shared in the welcome email. And we will be happy to take care of anyone or answer, even if it's just answering questions that you may have. With that, let me look briefly at the comments. So I see a question here is, when shopping for the best company, what do we look for besides for rate? So that is a great question, and it's something that we hinted to briefly, and that is what you're looking for besides for the rate is you're looking for the customer service. Honestly, you're looking for how long has the company been around? How easy is it to get somebody on the phone? Do people actually provide support and care for their caregivers, or are they just another number? Or are they just a way to bill Medicaid? Are they just having a high quality customer service? And if you're in the attendant care program, again, the benefits that a company offers also it makes a big difference. Some companies are offering benefits, others are not. So that's something you should be looking for. But the main things you want to find out, again, are customer service. Are they easy to get on the phone? Are the people there kind and supportive? Are they easy to talk to? Are their rates competitive? Are they offering benefits? And do they have established record of being able to do this and provide these services? Now, there are other detailed information about, depending if you're non-family caregiver, there's a different set of questions. Do they have lots of caregivers? Do they have lots of caregivers in your area? Is their office near you? And all those other things that can impact your experience as an employee. What is their overtime policy? So all of these things can go into an effect. But these are some of the questions that I would want to be asking. But the bottom line is, when it's a place that you work, you want to know that this company, that the people you're going to be working with and working for are going to care for you, are going to care about you, and not just the bottom line, not just the patient, not just the reimbursement. You want a place that cares about all of these things and is looking to take care of you. We thank you all for joining. We're going to wrap up now to this first ever Passion to Care live stream webinar. And again, please feel free to reach out if we can help and support. And we will shortly post this stream to our YouTube if you want to look back or share this with anybody who is relevant. Feel free to like or follow us and share this webinar with anyone who you think might benefit from the information we shared here. Take care and have a great one.